name is Ronnie Decker. I'm a registered nurse, and this is Nursing Analysis. Today we will be discussing infection control. We must begin this lecture by discussing certain terms utilized in the medical field specific to infection control. We will start with microorganisms. These tiny microscopic entities are naturally present on and in the human body. They also exist throughout the environment. There are two types of these microorganisms, pathogenic and non-pathogenic. The majority of all microorganisms are considered non-pathogenic. Non-pathogenic organisms are those that do not cause disease, harm, or death to another organism, and they can even help synthesize nutrients and prevent pathogenic microorganisms, those that do cause disease, from entering the body. It is important to understand when the immune system is weak or a non-pathogenic microorganism is introduced to an area of the body that it usually does not reside in, those non-pathogenic microbes can become dangerously infectious. So I bet you're wondering, how do we prevent infection and the spread of infection? We must discuss how infectious agents are transported and how they are able to continually be effective in continuing contamination. There are 6 elements necessary for infection to occur. The first is the infectious agent itself. This can be in the form of a bacterium, a virus, a fungi, a parasite, or what's called a prion. The second element is a reservoir. This is where the pathogen can grow. A reservoir can either be a human, an animal, a water source, soil, or an insect. The third element is an exit route from the reservoir. This is known as the portal of exit. The portal of exit can be through the respiratory tract, through droplets, or become airborne depending on how light the microorganism is in comparisons to the air it travels in. The gastrointestinal tract, the genitourinary tract, skin and mucous membranes, the blood and body fluids can also serve as a portal of exit. Now let us discuss the fourth element. The pathogen needs a mode of transmission. This transmission can occur directly from person-to-person contact or indirectly from fomite to person. A fomite is an object or material which is likely to carry infection. This includes clothes, utensils, and furniture. Transmission can also occur via the fecal-oral route when a person handles food after using the restroom and fails to properly wash their hands. Other routes of transmission are droplets from sneezing, coughing, or talking, and sometimes these droplets can become airborne. What usually determines the mode of transmission between droplets and airborne is the size of the microbe. Some microbes are lighter than air, which is less than 5 microns, and can travel great distances. Another mode of transmission can be vector-borne. This is when animals or insects spread infection to humans from their bites. The fifth element we will discuss is the portal of entrance. which can be the same as the portal of exit. Examples: skin, mucous membranes, or the mouth. The final element is the host or a susceptible host. This is someone with a compromised defense mechanism, such as breaks in the skin and or a weakened immune system. So, we must understand an infection occurs when a pathogen is able to complete the elements of the chain of infection. We as nurses need to break this chain so we can stop the spread of infection. Let's now discuss medical and surgical asepsis and standard precautions. Asepsis can be described as the absence of illness-producing microorganisms. The practices we utilize to meet this definition: medical asepsis, which reduces the number, growth, and spread of microorganisms. This is also known as the clean technique. These processes involve hand hygiene and the use of personal protective equipment, also known as PPE. Surgical asepsis is the practice of eliminating all microorganisms from an object or an area and preventing contamination by utilizing sterile technique. Standard precautions represents the first tier of the Centers for Disease Control guidelines for isolation precautions. These preventions reduce the risk of transmission of the infection. They protect both the healthcare provider and the patient from recognized and unrecognized sources of infection. We will utilize these precautions on all clients regardless of medical diagnosis or setting. It applies to blood, all body fluids, excretions and secretions except perspiration, regardless of whether blood is visible or whether skin and mucous membranes are intact. Hand hygiene is the most effective way to prevent the spread of microorganisms. We need to perform this before and after each client contact, immediately following exposure to blood or body fluids and contaminated items, and before and after donning gloves. We will remove all jewelry to facilitate hand disinfection. We will wash our hands with plain soap and water or use waterless alcohol-based hand rubs. We must remember the 3 essential components of hand washing. This includes soap, running water, and friction. We need to wash our hands when they are heavily soiled or when transient flora is present. We will wash for up to 2 minutes, but for a minimum of at least 20 seconds. Clean all surfaces of the hand with friction, including between the fingers, under the fingernails, and the backs of the hands. We then dry our hands with a clean paper towel. Before turning off the faucet, utilize another clean paper towel to shut the faucet off. When utilizing alcohol-based products, we will follow manufacturer guidelines. Usually between 3 to 5 mLs of alcohol-based sanitizer is placed in the palm of the hands and fingers. We will rub vigorously, covering all surfaces of both hands and fingers. We will continue to rub until both hands are completely dry. We must also recognize some other methods to reduce the spread of infection. This includes keeping our hair washed frequently and keeping the hair short or pulled back. The nails should be natural, not artificial, and they should be short, no longer than 1/4 of an inch in length, and they need to be kept clean. Let's now discuss PPE, personal protective equipment. This equipment is worn by healthcare providers to prevent the transmission of microorganisms. Gloves are worn to protect the hands when exposure to blood, body fluids, secretions and excretions, and contaminated items is likely, such as touching mucous membranes and non-intact skin. We will change them anytime they become torn or heavily soiled and between procedures, even when performed on the same patient. The gown. The gown is worn to protect the skin and clothing whenever splashing or spraying of fluids is possible. The mask protects the mucous membranes of the nose and mouth whenever splashes of fluid or particles are possible. It should fully cover the nose and mouth and cup underneath the chin. Make sure the mask is fitted down to the face by gently pushing and molding the guide wire with fingers, and the straps should be secured behind the ears. Eye protection, such as goggles, are worn to protect the eyes. Personal glasses are not a substitute. Face shields will protect the face, including the eyes, nose, and mouth. It should cover the forehead and extend below the chin and wrap around both sides of the face, and are used anytime splashes or sprays of fluid is likely. We will now briefly discuss the donning and doffing of PPE. We must perform this in a certain order as to maintain medical asepsis. We will wash our hands and don our PPE before coming into contact with the patient, usually outside the room. We will don the gown first, followed by the mask, then the eye protection, and then the gloves. When removing or doffing PPE, we must remove it carefully at the doorway of the patient's room. We will remove the gloves first, then the gown, or we can remove the gloves and gown together. If the gloves are removed first, the hands must only touch the uncontaminated surfaces of the gown, typically behind the neck, on the thighs, and at the back of the shoulders. The gown is then peeled off the body and arms, balling or rolling in the contaminated surfaces. This is difficult to do, however, without contaminating the hands. The preferred method for doffing a disposable gown and glove is therefore to break the ties at the neck by pulling on the upper front portion of the gown with the hands still gloved, balling or rolling in the contaminated surfaces, and pulling the gloves off inside out as the hands are withdrawn from the gown sleeves. The gown and gloves can then be placed in a disposable receptacle together. Next, we will remove the eye protection or face shield, and lastly, we will remove the mask. At any point, if our hands become visibly soiled, we will wash our hands, especially before removing any PPE on the face. We mentioned earlier about standard precautions and Tier 1 of the CDC isolation precautions. We must remember this tier applies to all body fluids except perspiration. We will now also mention Tier 2, also known as transmission-based precautions. These include airborne, droplet, and contact precautions. We utilize contact precautions to protect visitors and caregivers when they are within 3 feet of the client, or when having to come into direct contact with the client and their environment. When utilizing contact precautions, the client must be placed in a private room or in a room with other clients with the same infection. Gown and gloves must be worn by all caregivers and visitors, and all infectious dressings must be placed in a single non-porous bag. We must be careful to place the dressing or linens in the bag without touching the inside of the bag with our hands. Droplet precautions protect us against droplets that are larger than 5 microns and which can travel from 3 to 6 feet from the patient. Droplet precautions require a private room or a room with clients who have the same infection, ensuring that each client has his or her own equipment. Masks must be worn by all caregivers and visitors. Airborne precautions protect against droplet infections that are smaller than 5 microns. Airborne precautions require a private room, mask and respirator devices for all caregivers and visitors. We must use an N95 or high efficiency particulate air respirator. For tuberculosis infections, it requires a negative pressure airflow exchange in the patient's room that conducts at least 6 to 12 air exchanges per hour.
All nurses to the nurses station.
Code blue, room 305.
Let's now talk about additional methods to reduce the growth and spread of microorganisms. We can change linens, clean floors and bedside tables, wear PPE, and never place anything on the floor, including bed linens. We can cover our mouth and nose when coughing or sneezing. We need to dispose of used tissues properly. Cough into the bend of our elbow, not our hands, and perform hand hygiene often. We never shake bed linens as to prevent the spread of microorganisms. We will continue this discussion of this topic in Volume 2 of this series on surgical asepsis. It is now time for our rhyme time review. Let's begin by discussing the nurse's role when talking about asepsis and infection control. The elements for infection we must pick. As we remember, this number is 6, so we will go over them all so it will stick. We must discuss the infectious agent first, as this is the element that is the worst, needing a reservoir for it to grow and a portal of exit for it to go. We must use extreme suspicion as we determine the organism's mode of transmission. Remember, you can contract if there is any direct contact. In the air, we must stop, as it can take the form of a drop. Depending on the drop size, it may fall quickly or continue to rise. Now let's discuss the nurse's plan, which begins with the proper way to wash the hands. We can use microbe restriction with soap, running water, and friction. Also 3 to 5 milliliters of alcohol based. Just remember, we cannot use this for every case. Alcohol based may not be able to lift certain infections like C. diff. Before we conclude, I would like to give a special mention to Ellie B. from Medical Prep Institute, RN Cohort 44B, for passing her NCLEX and joining the RN family. I am asking my subscribers and viewers to give support and encouragement to the upcoming NCLEX candidates and RN cohorts 49 and 50. Just remember, it is not a matter of if, it's just a matter of when you too will become a registered nurse. As always, thank you for taking the time to learn with Nursing Analysis. Please like and subscribe to help us to continue to grow. As always, feel free to leave a comment and any questions or suggestions for future videos.
With rising health concerns and the need for changes in healthcare, nurses are needed now more than ever. At Medical Prep Institute, our goal is to educate and train knowledgeable and skillful nurses to fill that gap. We offer a quality education from well-qualified nursing instructors at an affordable price. Call or email us today to get started on your new career as a registered nurse.